Do you ever think about your trauma when you don't want to? Yeah, common PTSD symptom. Hey, I'm Dr. McCleary, licensed clinical psychologist and Navy veteran. And my channel is dedicated to educating veterans, service members, and their families about mental health. So if that's you, consider subscribing. Post-traumatic stress disorder, or PTSD, can be a pretty complex disorder. 20 different symptoms at different levels, at different times, at different situations. It can get messy real quick if you are the one that's experiencing these symptoms, if you know somebody who's experiencing these symptoms, or even if you're a clinician that doesn't have knowledge or expertise in the area. So I'm here to simplify and clear it up for you. In this series of short videos, I'm going to be breaking down some of the commonly misunderstood symptoms of PTSD and why some are symptoms and sometimes things that seem like symptoms of PTSD are not. In this video, I'm going to break down recurrent, involuntary, and intrusive distressing memories of the trauma, which are different than when you're just thinking about it. To be a symptom here, they have to be unwanted, which means you're not intentionally thinking about the trauma. You don't want to think about the trauma, and they're actually coming on their own. These memories also have to bother you. Sometimes people have done some good work on their trauma, and those memories no longer bother them. And guess what? If the memories no longer bother you, it's no longer a symptom. Lastly, these intrusive memories have to happen while you are awake. That means that if you have dreams of distressing memories of the trauma, that does not count towards a symptom of intrusive memories. So that's recurrent, involuntary, intrusive, distressing memories of a trauma. Pretty simple, right? Not necessarily. One question that I get all the time is, well, what's the difference between having intrusive memories and flashbacks? In order to get that answered for you, click on that next video, because I'm going to do one totally on flashbacks. Stay tuned. If this video was helpful for you, and I hope that it was, please like it or consider subscribing to my channel if you want to learn more about PTSD and mental health. But more important than that, if this video was helpful for you, that means it can probably be helpful for another veteran or another friend or family member of a veteran. So I ask that you share it with them, because at the end of the day, that's really what all this is about. One veteran trying to help another.